Great. Thank you, Greg. Good morning, everybody. We're pleased to be here with you this morning. My name is Patrick Plues. I'm Vice President for State Government Affairs at Bio. I have a team of folks who work for me that cover the country, and we work very closely with Greg in a lot of our efforts in New Mexico, not only on biopharma issues, but on some of the ag and environment issues that we engage in as well. So today I'm going to talk to you a little bit about a report that we put out every 2 years that measures the strength of the bioscience industry in the country. And when we say the bioscience industry, we mean pretty much every aspect of biotechnology. It's inclusive of biopharmaceuticals, ag and industrial biotech, the research side of biotechnology, medical devices, as well as the distribution networks of biotechnology. This report comes out every 2 years. The latest one we have just was released in fall of 2022. And we have it electronically on our webpage. I'll tell you how to get to it in a bit. And we'll send also a PDF version to Greg, and he can get it out to attendees as a follow-up. But as I mentioned, there's 5 segments of the biosciences that we look at in this report, and I just went through them. So it's not just biopharmaceuticals, but it's pretty comprehensive. The industry really is a significant driver of the economy in this country. It has a total impact of $2.9 trillion. That's key, $1 trillion to the U.S. economy. It directly employs 2.14 million people in the country. And then the industry has what's called a multiplier. For every person that's directly employed by the industry, there are another 4 to 5 people that are indirectly employed by the industry. These would be service providers, things like that. So in all, if you look at both indirect and direct employment in the country, in 2022, there were 10.3 million people across the country employed by the biosciences, which is really significant. And it represents about $796 billion in wages. So we are a major part of the economy, and it's growing. Our report has measured growth in the industry from 2018 to 2021. And as you recall, this is sort of in the middle of the pandemic when a lot of industries were contracting and employment was an issue, where our industry grew by 22%, employees grew by 11%, and wages grew by 16%, which outpaced every other private sector industry group in the country that's measured by the federal government. Also, this outpaced other technology-heavy industries such as aeroscience, software, and computer hardware manufacturing and development. So it's a very significant part of the economy. In New Mexico, the report goes through each state. And in New Mexico, there's a lot of increase in this industry. We've seen a 15% growth since 2018. Roughly 6,800 people are directly employed by the industry. And what I find interesting is there are roughly 770 bioscience in those 5 buckets I mentioned earlier, bioscience entities within New Mexico, which is fantastic. And there's a VC, or a venture capital investment in New Mexico of roughly 330 million, according to the data that we find, which is significant and shows that it's a very key part of the New Mexico economy. What I will say is a lot of states are trying to diversify their economy, especially a lot of states in the Southwest are trying to diversify their economy, and they're looking at this industry as one of the drivers in their economy. I know Nevada is very interested in diversifying its economy, is looking to the life sciences to attract companies to locate there or to start companies there. A lot of other states are looking at different types of tax incentives to increase growth in the industry. These could be everything from R&D tax credits to SBIR matching grants to angel investor tax credits. So there's a lot of activity around the country to grow this industry sector in their states. The report has a lot of great information. As I said, I will send it to Greg and he will get it out to folks. We have it electronically, and you can peruse it yourself at your leisure. We're also going to develop another report that will come out probably in the middle of this year, and that's what we call our best practices report. And we do that every other year as well. And that looks at what states are doing in the economic development world to attract and to retain this industry. And it talks about everything from workforce development initiatives, community college funding, and the various types of tax incentives and grant programs that states are implementing to build and strengthen this industry. So with that, I know you've got a full agenda today. I'm going to turn it over to my colleague, Aiken. Aiken, I handle the state government affairs work at Bio. Aiken is my colleague who handles the federal government affairs side. And there's been a lot of activity this past congressional session that really has a direct impact on our industry. So I'm going to hand it over to Aiken. Then Greg, if you want, we can open up for questions after that.
Thanks, Patrick, and good morning, everyone. Thank you again for having us today. I feel like I've been doing this talk a lot recently, but I would like to kind of go through exactly what happened last November and what we expect in Congress this year. And so I feel like we're kind of over talking about the election, but we're just going to kind of have a little bit of a recap. As I think most of the nation saw, we were expecting to have kind of a red wave coming into the United States, and it really wasn't much of a wave, but certainly had a change in leadership in the House. And we've had I would say, a very slow but chaotic start here, kind of starting off the beginning of this year with last week's multiple votes to finally get our newly elected Speaker of the House, Kevin McCarthy of California. So again, it was a really slow start. And again, we're in a brand new Congress, and so there's going to be a lot of new faces to see right now. We have, just for like a level set, there are going to be 84 new members of Congress. That includes 77 members of the House of Representatives and 7 new senators. And if you take that into consideration of how much education needs to be done right now, it's a lot. So our federal government relations team here in Washington is going to be blanketing the Hill to make sure that we educate all of these new members these days. Just kind of for a background, I'm the Vice President of Federal Government Relations here at Bio, and I manage a team of 9 people, many of which are lobbyists who spend their lives trying to educate members. And so we'll have, again, a lot of work to do kind of moving forward. So again, a little bit of the level set right now. So we will have a number of new key leaders of committees, especially with the change into the Republican leadership. So you look at a committee like the Ways and Means Committee, which has a jurisdiction that's extremely broad. It deals with tax issues, it deals with trade issues, it deals with a lot of healthcare issues. And so we have a new chairman of that committee that will basically start his job today. We just decided the Republican conference appointed him last night to be the new leader of the committee. We'll have a new leader of the Budget Committee. So the Budget Committee, led by now Jody Arrington of Texas, will be kind of putting forth the budget that what Congress needs to deal with. With that, we're also going to have new members of the committee. So we have a lot of folks to basically go out and educate of committees that have broad jurisdiction over a lot of the bioscience industry and what we need to do to kind of build them up and make sure they know what is biotechnology in general, and then 2, what are the issues that are really important to us as an industry, and how do we kind of communicate with them and build new champions as we have, again, a huge wave of new members coming into Washington. So again, there's a lot of work to really be done right now, and we're real excited to hit the ground running. On the Senate side of the world, things are a little bit different. I think there's not really a significant change necessarily, but because the Democrats have for certain now a majority. So last Congress, they had a 50-50 split, with the vice president essentially being the change in the tie vote. Right now, they have a 51-49 seat majority. Well, technically it's 48 because Ben Sass, who's a senator from Nebraska, resigned on Sunday, and Nebraska will now appoint a new senator for that. So we basically have a 51-49 split, which puts the Democrats in the actual majority. So the ratios of the committee on the Senate side are going to be tilting in favor of the Democrats. The Democratic committees in the Senate that are the committees in the Senate that are really important to us are things like the Senate Finance Committee that has jurisdiction over Medicare, Medicaid, and a lot of the finance issues that we face. And then you have the Senate Health, Education, Labor, and Pensions Committee, which deals with a number of issues, obviously healthcare being one of them, and they do more of the public health issues, but also has jurisdiction over the CDC, the FDA, the NIH, in programs such as that. They deal with a lot of, again, public health issues. The strange thing there is that Bernie Sanders is going to be the new chairman of that committee. And so Bernie Sanders being the national figure that he is, we kind of know what he thinks about what our industry is, and especially on the biopharma side of things. He has a very staunch position on his belief of essentially socialized medicine and for the government takeover of our healthcare system, which really does impact a lot of what we do in the life sciences arena. So it's going to be real interesting to see how he works with his new partner, who is Senator Bill Cassidy of Louisiana, who is a physician by training, has been around Congress for over a decade, but has a very different view of how you develop policies that address issues impacting our industry. So I think those are kind of the way that we look at it, is that this, again, is a very new Congress with a lot of education to be done, and we're kind of going to have to see what people's new priorities are and what they want to do. So I think a good question that I think that we all wanted to probably hear about is, what do we expect Congress to do that will impact our industry? So first and foremost, I would put it in a few buckets. It's almost like what has to get done, what would be nice to get done, and then really what is a good messaging piece for folks to deal with. So I think if you look at what has to be done, first and foremost, we have to fund the government. We'll see how that goes with the new Congress that we have at hand. But first and foremost, on like kind of that is the basics. The debt ceiling is also something that we are addressing right now, and so having to deal with how we raise the debt ceiling to make sure that we don't default on our loans is also something that's going to be pretty important. But when it comes to healthcare, there's a few like low-hanging fruits things that are bipartisan that really should. So for the fourth time, so every 4 years, we reauthorize this program called the Pandemics All Hazards Preparedness Act. And that really is a program to deal with pandemic preparedness. When we reauthorized it the last time, it was actually 2019. So imagine what we dealt with over the past 4 years of a pandemic and all the lessons that we really have learned since then. And so we'll be having to reauthorize PAPA, is what we call it in DC. It deals with a lot of things in the biodefense world, but can kind of broaden itself out to various areas to make sure we have the funding and the resources, that we have enough things in the strategic national stockpile to make sure that we're prepared for the pandemic. How do we address like the vaccine issues that we have these days? So those will be issues that will come along with, again, reauthorizing PAPA. Also up this year is the reauthorization of the Support Act. So the Support Act back in 2018 was a program that was basically to address the opioid crisis across the nation. And so it's a huge bill with a lot of comprehensive opioid related issues that will also be something that will be front and center that needs to be reauthorized. Whether we can go through this bill or these packages that are going to be so broad and will be, maybe have a heavy price tag, maybe not have a heavy price tag, but certainly a number of other policies. It'll be interesting to see how Congress really decides that they're going to address these programs that, should be up for reauthorization this year. When it comes to the House, I think that you will certainly see Republicans really try to unpack and unravel what was passed in the Inflation Reduction Act. So I know obviously something that's very important to our industry are the policies included in that. And I think, again, going back to the 84 new members of Congress, just first and foremost, we have to educate these new guys on what is actually in the IRA, especially when it comes down to the drug pricing proposals that were included in it. So one, it will be basic education, but then how do we see ways to actually mitigate the damages that it's done? And I think you could also put that into a couple of buckets of, are there bipartisan ways to not necessarily improve the bill, but to make sure that we can like maybe chip away at it, so the most devastating policies that are included in that could actually be removed, or there's ways to kind of improve the nature of it. So when it comes down to the bipartisan policies that maybe we could get across the finish line, there'll be things with, in the IRA, there's an orphan drug exemption that allows for a company with one orphan drug to not be subject to negotiation just because of with that one orphan drug. Could you expand that if that one orphan drug has a second indication, and to make sure that we are not hurting those patient populations that are, again, most vulnerable? So that's something that seemingly sounds like it would be certainly bipartisan. There's a small biotech carve out. I'm sure many of the companies in the room right now care about the small biotech carve out, but it's a very limited carve out. So for in the actual law, if you were a small biotech company in 2021, and based on your certain revenue numbers, you will be not subject to negotiation for a 3-year period. Can we expand that to make sure that we always are supporting and protecting the small biotech, especially in the startup community? And so that's something that we will continue to look at as a bipartisan way to improve that. And then you also have the things that are a little bit more complicated about the discrepancy between a small molecule and a large molecule. And in this, they have you're subject to negotiation based on a 9-year or 13-year if you are a small versus a large molecule. And there's ways to maybe equalize that so you would not be penalized if you are a small molecule. And so those are issues that may be bipartisan, but they also could be a partisan thing. And then when it comes down to a kind of a broad message from House Republicans, you may see them have a somewhat of a repeal bill, but I think that we certainly learned our lesson in 2010 and going forward that repeal and replace is not necessarily as easy as you say it was, even if this bill is kind of being devastating to innovation in itself. There were some positive things in the IRA, and I do not want to not disregard those. We have a cap on patient out-of-pocket costs in Medicare. So the seniors in our nation will obviously be protected by that. And then we also have the ability to smooth it out over time. So if you have a high price drug in January, you will be able to pay over time until you reach that cap. And so there were still, again, good things, at least on the biopharma side of things in the bill. When it comes down to the ag space, I think we actually had a lot of big wins in the IRA when it comes down to a lot of the tax credits that were there. But I think we spend so much time really focused on the biopharma side of things because of the way that those price controls really will impact innovation. So those are kind of things with regards to the IRA. I would also say that people are certainly interested in PBM reform, and whether it's going to be something that can really be bipartisan or not, I think it will still be kind of left unknown. But oversight of that program or of the PBMs are certainly there. I mean, I think that seeing the vertical integration that is happening amongst plans right now is certainly something that has drawn scrutiny. Last year, the House Oversight and what we now call the Oversight and Accountability Committee, led by House Republicans at the time, really dug into what was going on in the behaviors of the plans and the PBMs. So I think that's something that is really kind of getting a lot more attention. And also with that, you have the tools that the plans use to essentially mess with the system in a way. So the accumulators and maximizers and copay coupons are things that people want to look at. I would say formulary placement is something that people want to look at. Formulary exclusion in that sense. And so obviously the way that the plans work really does have a huge impact to patients. And so we're going to obviously want to dig into that more with Congress. There's also interest on the Senate side in that as well, led by, again, Chairman Ron Wyden of Oregon. He cares a lot about PBM oversight. So I think we'll have much more scrutiny to that industry that was essentially not at all included in the IRA. 340B is also another big issue. I think the narrative is changing a lot. We all know that we love our hospital systems, and certainly a lot of them deserve the 340B discounts that they get because of the charity care that they provide. But I feel like there's been a lot of national press on the egregious behaviors of some of these large hospital systems. And so what can we do to kind of, again, shed light on the behaviors of the hospitals and to make sure that the program is actually being utilized the way that of the original intent. And that is really making sure that the patients of need are getting the benefits of what this program is, and not to really abuse the system to pat the backs of the large hospital systems in certain areas. So those are also things that we certainly will be looking at. I think that probably is it really from a kind of broad stand. The one additional piece I will flag is intellectual property is getting a lot of attention these days. And I feel like that is almost dovetails into the drug pricing debate as well. So are there opportunity, are there ways that Congress will look at our IP protections and try to mess with them to get at drug pricing? And it's almost like how we are viewed with the generic industry. So I think it's something that will certainly shed a lot of it will be something we'll push back on over this Congress, especially again with someone like Bernie Sanders at the Help Committee, and what can he do to kind of look at the IP protections that are really important to our industry. Again, it's going to be a crazy Congress with the small margins that are there. So just as a reminder, the House of Representatives ratios are 222 to 212. We're missing Don McEachin of Virginia, unfortunately passed away right after the election. And so they're going to have a special election in Virginia to replace him, which will be a Democrat. So they'll have the ratios of 222 to 213. So 218 is how you pass a bill. And we saw this again with the speaker vote. It's with those close margins, it's really hard to really work together. And really, at the end of the day, does that make it be a bipartisan solution to get some of the things that this nation needs to get done? And the Senate, again, with the 51-49 split, it's going to be kind of the same. And then with President Biden in the White House, you have to find a way to make sure that we do the real work that this country needs. But in the kind of the political dynamics that we're in right now, things are real dicey. But certainly the New Mexico delegation is obviously always important. You have a new member. You have your two other folks in your delegation obviously just came in the last Congress. So there's still a lot of education to do in the New Mexico delegation in the House, and obviously with y'all senators being who they are, we will look forward to some good outreach to y'all and engaging with your home state people, and it's going to be an exciting year. But with that, I'll turn it back over to you all.
Thank you very much. Anyone have any questions to start with? If not, I'll start with one for Patrick.
Sure.
I know our major conference is taking place for the biotech industry this week in San Francisco. One of the reports read basically that this is going to be an extremely tough year for startups to get funding. Are you hearing anything from basically our bio members to that same effect as that report?
Yeah, I mean, we've talked a lot with our smaller startup companies. We have a section we call our emerging companies section. We've had conversations with them starting last year about the challenging environment right now for raising funds, startup funds especially. You know, I think this is just, I really do think it's a market correction. I think, you know, investors are going to be more wise with their money. And I know that our companies are looking at ways to convince states, like I had said earlier, to institute certain tax incentives that would allow for greater investment, especially from angel investors. So there is there is a lot of discussion going on at Bio about last year and this year being a challenging year to raise money. That doesn't mean the industry is in a slump. I think we've seen some big deals that were announced just at the close of the year with Amgen acquiring Horizon and BMS and GSK acquiring some of their smaller biotechs. So there is activity out there. I just think the technology has to be worth the investment, quite frankly.
Thank you.
Mm-hmm.
All right, I'll throw one out to Aiken. Basically, you focused on the federal today. Can you also give us maybe your viewpoint in terms of what's happening at the different states and what the issues for them are going to be?
I'm going to let Patrick take on that one.
Yeah, so that's sort of my bailiwick. Okay. So we are, you know, there's a number of issues we're going to see in the states, and they kind of mirror what's happening in Congress. You'll see continued risk with drug pricing legislation. As a matter of fact, we anticipate in New Mexico that a prescription drug affordability board bill will be introduced. And what these are, we've seen a number of these pass. Colorado passed one last year. Basically, they set up a board within the state that looks at the price of a given therapy. If that therapy goes above a price level that's set in the underlying statute. And if this board determines that the price of that therapy is too high, then they can institute what's called an upper payment limit, or that's a nice word for price control. So we're seeing, you know, that we could expect to see that introduced in New Mexico this year. and especially given the governor's interest in healthcare on this. So that's an issue that we're seeing across the country. We're seeing a lot of activity in states on vaccine legislation, particularly around, because this issue has become so politicized that, Republican-leaning legislatures are looking to sort of mitigate the mandates or lessen the mandates on vaccines, whereas more Democratic-leaning legislatures are looking to embrace vaccines more wholly. So it's becoming a political hot potato. We're seeing a lot of work in 340B, as Aiken pointed out. This issue is getting a lot of press now, and we're seeing states starting to engage in the whole 340B issue. So we're going to have our plates full, but I know for New Mexico, we're particularly concerned about some of the drug pricing legislation that we could see in Santa Fe this session.
Thank you.
Mm-hmm.
Rick?
Yeah, this question is for Aiken. Aiken, you briefly delved into SBIR and STTR funds from the NIH. Can you delve any deeper? Like, do you see any changes in allotments for the NIH's budget going forward?
So the only thing I'll say about the NIH budget holistically is that in the negotiations that some of the Freedom Caucus members made with the new speaker, they want to keep the funding levels at the appropriations funding levels at FY22. So holistically, it's supposed to make a 9.3% reduction from what was in FY23. So I think we don't know yet how that's really going to impact really the broader NIH budget. But obviously the program was reauthorized back in the fall. And so I think we're pleased to see that. So I don't really know about the allocations and the details there. But I would say, I think it's probably still too soon to tell if there's going to be any significant way. But I feel like with the program being reauthorized back in the fall, I think that we should be in a good place for at least now.
Okay, seeing no hands, I want to thank you very, very much. Thanks very much.